Hey, I'm Dr. Kelsey with the Kelsey Canine Medical Center, again, out in Collierville, Tennessee. This is our second video about the canine flu virus. And so in this video, I want to talk about symptoms and treatment and just some general recommendations. So canine flu, if your dog was to have this, looks very similar to kennel cough, but maybe in a worse, let's say a bad case of kennel cough. So some of your pets may have had kennel cough in the past, and that kind of looks like the canine flu looks similarly with coughing and sneezing. The sneezing could be clear, it could be snotty, they could run a fever and just generally be lethargic. And some of them, of course, won't have a very good appetite or have inappetence where they won't eat at all. So, that sounds kind of similar to when we have the flu, that we don't feel good, run a fever, etc. So if you are seeing that in your dog, of course, you need to holler at us and give us a call, and we need to take a look at him or her. They are contagious for up to 6 days during the symptoms. So when they have that, they are able to spread the disease for up to about a week. When they're showing symptoms. Now, there's not a cure for the canine flu. Cornell is working on a vaccine study to see if the current vaccine works against this new Asian strain, the H3N2, but we don't know yet. But we do treat the symptoms of the flu, the fever. We'll put them on a lot of times anti-inflammatories. We might use some antibiotics because secondarily, pets will or dogs will get bacteria in their lungs. They could get a pneumonia type issue. So a lot of times the other thing we might do is give them fluids and keep them in the hospital. It really just depends on how bad and how sick your pet is with the canine flu if they were to get it. The good news is that 90% or even over 90% are going to be cured or going to get through the canine flu outbreak. They might experience some sickness and some of the symptoms, but if you treat them and even treat them as outpatients, most of them will clear it. Less than 10% may not make it through a bout of canine flu. Some of those dogs might have other conditions or diseases that are going on that they're battling against at the same time, which would not help them to clear the canine flu. So the good news is most dogs will pull through and do well through canine flu if they have it. There is a PCR test. It's a nasal swab test that we run, and it is a DNA test, and that test is done by Cornell, and that gets sent off to a lab. So there is a test available to see if your pet had it or has it. They have to have symptoms for about 48 hours before the test is effective. And again, I do want to stress that the canine flu has not been found in our area, which is the good news. And so not to panic. If your pet is showing symptoms like this, it's most likely just the kennel cough, a case of kennel cough. So, and you're a veterinarian, and we can treat that. So if you are seeing symptoms, of course, give us a call and we'll take a look at him or her. But again, this is Dr. Kelsey. I wanted to just give you guys an update on what's going on with the canine flu. Thank you.